All right. Wouldn't it be nice to get up and just be able to dance to that a little bit and not have your back hurt you when you did it? I know a lot of you are dealing with that this morning, and we'd really like to get you feeling better. So Dr. Nicholas LaHood is here this morning from the San Diego Spine and Disc Laser Pain Center once again. Just the idea of just getting up out of the chair and just dancing a little bit to some people is, they cringe just thinking about it.
Yeah, a lot of people can't do it because of the severe chronic back pain that they're having. And, you know, 80% of people in the city will suffer from severe back pain at some time in their life.
At some time in their life. And I mean, I've gone through it myself, and I'm fairly athletic and in decent shape, but it happens. Sometimes we don't always understand what's going on.
And it can build to a cumulative effect where there's so much pressure on the joints in the back. And if the biomechanics change and if the disc starts to become degenerative, it becomes so painful, Mark.
Well, folks, here, let me just make this offer up front here so that you go ahead and pick up the phone, and everybody's got, you know, wireless phones now, and so you can watch the segment here and already start dialing. For the first 25 callers, Dr. LaHood would like to give you an absolutely free examination and 2 free non-surgical back treatments that could change your life. It's called spinal decompression. There's some laser treatments involved with that. Again, totally non-invasive, absolutely free, no obligation, but for the first 25 callers, start calling now. Now, who does this apply to in general?
This applies to people who have chronic back pain that doesn't go away. If they're taking Tylenol or Advil or even Vicodin or hydrocodone.
Or even those injections?
Even those epidural injections. So severe chronic cases, if the patient is starting to use a walker or wheelchair or cane to assist them to help with their balance due to the pain that they're having in their back, this applies to those patients.
Now, folks, it doesn't have to be that severe. And again, we'd like to get to you before you're even thinking about surgery. But if it comes down to surgery, this is what many folks are facing, Dr. LaHood. And this is this is like Frankenstein. This is a frightening proposition here.
If you are getting the epidurals, and then the next step for you is to have a laminectomy or a discectomy or this type of lumbar fusion, come and consult with our office. Go through our 2 free treatments if you qualify and see if the non-surgical solution could help you avoid one of these massive surgeries. Because, Mark, we know through research that those surgeries change your spine forever.
Forever, and they fail at an alarming rate. Now, this is a great animation of what happens here. If you've got a bulging disc, folks, it's the tissue from the disc actually pushing out between the bones and bulging out. Now, if you take the pressure off, that disc will retract back into its natural position and take the pressure off of that red nerve that you see there that's no longer red. That pain radiates all over the body, doesn't it?
It could go right down the leg. If a person has these cervical discs that are herniated or degenerative, the pain can shoot into their arm. It's almost similar to a car with a flat tire, and constantly walking around with a deflated disc that's crushing the nerve. We recognize that medicine or pills are not going to be a long-term solution. You'll have to keep taking it. So if we can pump the disc back up and open the space, it's a satisfaction to the patient like no other.
Now, the body has an amazing ability to heal itself with a little help here. So with decompression, you gently put pressure on the spine or on the back to pull those discs apart very gently. People will hardly even know that it's happening. But the secret here is, you know, you can hang in one of those vertical, you know, hanging apparatus, and that's a constant pressure. But this is a pumping action here. Why is that important?
The disc is full of fluid, and you want to have an exchange of microparticles going in and out of the disc tissue to keep it hydrated and keep it healthy. So if you just hang upside down, or if you try to do core exercises to strengthen the back, what your discs need to stay healthy is fluid. And if you don't have a pumping action to pump fluid in and out of the tissue, you're going to continue to go into that degenerative state.
So this puts fluid back in the tissue. Now, the thing is, when you stand up again and put pressure back on the spine, that disc is going to, eventually it's going to bulge back out again. So how do you prevent that? That's where the laser comes in.
We found that with research, the disc is herniated or bulging because of so many annular tears or cracks and fissures in the disc. The class 4 deep tissue laser that we use helps your body stimulate its own healing mechanisms to seal up the cracks and tears that have occurred in the disc.
So folks, again, totally non-invasive. It's a very, very low-risk procedure, but you'll be thoroughly evaluated by the doctor before they put you on the machine. Folks go to sleep during the thing. It's so gentle, but you're going to make sure that it's right for a person before you try it. And lots of folks experience relief just from one or two of these free treatments.
You know, we see such a great amount of success with our patients. Some patients feel 50% better after their first treatment. So I would encourage you to, if you have a major back condition, call the office and take advantage of this offer.
And you can call on behalf of somebody else, folks. If they don't happen to be around the TV right now, call them, make the appointment. You drive them down there. Assure them that it's not going to cost them a nickel until they're absolutely sure that this treatment will work for them. 2 free treatments, folks. Dr. LaHood, thank you for coming in.
Thank you, Mark.
As always, San Diego Spine and Disc Laser Pain Center. Now, for more information, you go to san diego6.com and you click on San Diego Living.